This video will discuss solution-focused brief therapy and its context within a dietetic setting. Solution-focused brief therapy, also known as brief therapy, is a counselling approach which exclusively focuses on discovering solutions to problems rather than exploring the causes or history of the problem. Clients are empowered to use solution-orientated language, speaking about what they can do differently whilst acknowledging their strengths, resources, competencies, and past successes in solving their own problems. Solution-based therapy was developed by Steve and his colleagues at the Brief Therapy Family Center in Milwaukee, USA, 1978. The therapy is popularly used by trained therapists in North America, Europe, Canada, Australia, New Zealand, and Asia. Solution-focused brief therapy is used in a number of different settings, such as community mental health centers, private psychiatric practices, hospitals, schools, residential treatment centers, corporate settings, coaching, rehabilitation centers, and child protective agencies. It has been used for individuals, couples, and families in treatment of a variety of problems such as depression, eating disorders, drug and alcohol abuse, sexual abuse and trauma, family conflict, relationship difficulties, and mental health problems. Solution-focused therapists start by asking a miracle question which encourages clients to describe how their lives would be different if a miracle happened overnight and their problems ceased to exist. Therapists work collaboratively with clients to identify exceptions and past successes where the clients have behaved differently and used coping skills successfully when presented with a problem. Through investigating accomplishments clients have made in the past, adaptive strategies are likely to emerge. This allows for the natural progression towards the setting of small, manageable goals based on what is already working for the client. At future sessions, therapists ask clients to rate their progress towards their goals on a scale of 0 to 10, with 0 being the day the client started therapy and 10 being the day after the miracle has occurred. The scale allows clients to talk about their achievements and what things they need to do to move higher on the scale. A major principle of solution-focused therapy is the belief that only small changes are necessary and there will be gradual improvement as more changes are made. This will eventually result in much larger systemic change. Another essential component of solution-based therapy is the use of frequent compliments, where therapists validate that the client is doing well. A major difference between solution-focused therapy and other traditional therapies is that solution-focused therapists use a future-focused approach, and the only attention paid to the past is on past successes. Solution-focused therapy also has a brief nature, with the average length of treatment lasting 6 sessions. The efficiency of solution-focused therapy reduces the amount of time clients spend struggling with their problem and allows the therapist to see more clients. Where other therapies describe clients as resistant to change, solution-focused therapy attributes a lack of change to therapist error and no fault is assigned to the client. Solution-focused therapy fosters the development of a positive relationship between the client and the therapist, as therapists focus on what the clients are doing well rather than what they are doing wrong. We interviewed Professor Antigone Kouros, an accredited qualified dietitian, to see if she used the solution-focused therapy approach in her dietetic practice. Before the interview, as a group, we first came up with many questions that we were wanting to ask Antigone. The questions asked were open-ended to gain an understanding of the appropriateness of solution-focused therapy in her work setting. We aimed to explore her understanding of solution-focused therapy, whether she used it in her practice, and if not, why she didn't. In order to get background information on Antigone's work as a dietitian, we asked her about her current practices as a dietitian, such as what she does or who her patients are, to understand her general work context. She has over 28 years of experience in the field, specializing in weight loss, and seeks to address the biochemical issues of one's nutrition status. She shares a private practice with a psychologist and mainly deals with clients over 30 years of age. Antigone sees a variety of patients, with majority of them seeing her for weight loss. Other patients include having different conditions such as IBS, reflux, gastritis, indigestion, diabetes, cholesterol, and acne. We then asked her questions regarding the type of counselling approaches she uses in her practice. Antigone said that she uses solution-focused therapy and her patients come to her expecting her to come up with a solution to their problem. Antigone explained a typical consultation to demonstrate how she used solution-focused therapy in her practice, saying that she would take a diet history, look at the biochemistry, collect data about symptoms, and then recommend personalized changes to achieve their desired solution. Typically, she focuses on biochemical results rather than behavioral aspects in terms of diet. She also mentioned that she does not use cognitive behavior therapy as she has not received relevant training. Whilst Antigone did believe that she uses solution-focused therapy as she was helping clients find solutions to their problems, her interpretation of solution-focused therapy was very different to how it is defined by original developers and in the literature. Solution-focused therapists pay little attention to the details or causes of the client's problem, whereas Antigone does a very thorough analysis of the client's problem. This is because she needs this information, such as the client's biochemistry, to guide her intervention with the client. Antigone also makes suggestions on what she thinks are the most effective changes the client should make, whereas solution-focused therapists wait for the client to suggest the changes they think they can make, based on what has worked for them in the past. When clients have emotional difficulties or difficulty changing their behavior, she refers them on to a psychologist or hypnotherapist for further support to make those changes. This is different to solution-focused therapists who attribute clients not changing to therapist errors or the solutions not being appropriate for the client. She also does not use miracle questions, look for exceptions, or use scaling questions, which are core practices of solution-focused therapists. Although Antigone does not use solution-focused therapy entirely, she does use aspects of it, such as negotiating and collaborating with clients to set realistic goals they believe they can achieve. She also encourages clients to self-monitor their progress towards their goals. Antigone also felt that her clients were coming to her motivated and ready to change, which is the same philosophy that solution-focused therapists have. Overall, it looks like dietitians like Antigone have adapted their own counselling style in private practice settings. Antigone uses her own personalised approach with some elements of solution-focused therapy, such as goal setting, negotiation, and collaboration. She felt that her approach was the most effective way to help her clients who needed her expertise to solve their problems in the most timely manner possible. This approach is most likely effective with clients who are highly motivated to change. After the interview with Antigone, a literature review was conducted. Solution-focused brief therapy is a counselling approach which exclusively focuses on discovering solutions to problems rather than exploring the causes or history of the problem. Solution-focused therapy is used in a number of different settings, such as community mental health centres, hospitals, schools, and coaching. The number of sessions for solution-focused therapy is variable, but the minimum number of sessions found to be most effective is 6. Previous research has shown solution-focused therapy to be effective in reducing anxiety of adolescents and suggests that solution-focused therapy has a positive effect on behavioural change. In our literature review, our aim was to investigate the effectiveness of solution-focused brief therapy on dietary changes in all ages compared to other therapy styles or no intervention. A search of Cochrane collaboration, Ovid Medline, and PsycInfo databases were conducted for randomized controlled trials. Additional articles were identified by searching the reference list of relevant eligible articles. As seen in the table, the key term we searched was solution-focused brief therapy and its alternatives such as brief therapy combined with Nutri and diet. The inclusion criteria required articles to be randomized controlled trials, participants of all ages, and written in English, as there was no faculty for translating foreign papers. Articles were excluded if the intervention combined solution-focused therapy with another therapy approach, as it was too difficult to differentiate if the solution-based therapy had an effect on outcomes alone or if it was a combination of the interventions. Studies were also excluded if the study did not investigate dietary changes. All studies had to have a control group, whether that was no intervention or another therapy style. Articles were also excluded if the full text was not available. After we applied the inclusion and exclusion criteria, 4 articles were included for analysis. Interventions investigated the outcome of solution-based therapy with changes in nutrition and physical activity. As seen in the table, 3 studies had participants that were overweight or obese, whereas 1 study had participants that had a healthy weight. All studies had a doctor to implement the therapy to impose positive changes in dietary behaviours. Whilst the search was conducted for all ages, the study used included people between the ages of 5 and 21 years. The sample size varied from 32 to 3,059 participants. The location of all studies were quite similar as they were all conducted in first world countries. 2 were conducted in Australia, 1 conducted in Finland, and the other in Turkey. 2 studies gave 4 consultations over 12 weeks. 1 study gave 3 to 5 consultations over 2.5 years, and another study gave 8 consultations over 4 months. Only 1 study showed that solution-focused therapy significantly improved nutrition, exercise attitudes, and behaviour scale scores. This significance was shown by a p-value of less than 0.001. A common limitation we found during our literature review was the lack of research completed in a dietetic setting. This made it difficult to generalise and get an accurate representation of how the therapy is used in dietetics. There was also no studies that actually used a dietitian to administer the solution-based therapy. In the 4 studies we used, the GPs conducted the consultation. 3 of the studies that were found to be not significant only did 3 to 5 consultations, whereas the successful study did 8 consultations over a 4-month period. This is consistent with our findings that a minimum number of 6 consultations should be used with solution-focused therapy. 2 of the studies had a large dropout rate, with only 37% of participants attending all sessions in one and only 21% attending all sessions in the other study. This could contribute to the unsuccessful outcome seen in these studies. In conclusion, only 1 RCT showed that solution-focused therapy could successfully change dietary behaviours. However, all the interventions in these studies comprised of 3 to 5 consultations. More research is needed into solution-focused therapy with a minimum of 6 sessions, especially utilising a dietitian. To summarise this presentation, solution-focused brief therapy, also known as brief therapy, is a counselling approach which exclusively focuses on discovering solutions to problems rather than exploring the causes or history of the problem. A major difference between solution-focused therapy and other traditional therapies is that solution-focused therapists use a future-focused approach, and the only attention paid to the past is on past successes, fostering the development of a positive relationship between the client and the therapist, as therapists focus on what the clients are doing well rather than what they are doing wrong. It can be implied that Antigone doesn't use solution-focused therapy entirely. She merely uses aspects of it to assess the condition of clients and remains realistic about the approach she takes. She asks the necessary questions and focuses overall on achieving a positive solution for the client. However, she doesn't specifically use miracle or scaling questions to achieve this. Previous research has shown solution-focused therapy to be effective in reducing anxiety of adolescents. The literature suggests that solution-focused therapy has a positive effect on behavioural change. However, more studies need to be conducted with a minimum of 6 sessions and utilising a dietitian or a dietetic setting.